Now, can you describe the symptoms of this mystery disease and how is it spreading?
Thank you so much for having me. It's a mysterious disease because so far investigations show that they don't really know what the disease is. But the symptoms people are presenting with, and of course the most alarming is the fact that the death after onset is 48 hours. And so that's what is really alarming. But then people are presenting with diarrhea, vomiting, abdominal pain. Some people have stiff neck, and then others are coughing. Then they have a fever as well. So these are the general presentations that people are coming with.
Dr. Teta, we understand that the first three victims were three children. They ate the carcass of a bat, from what I understand. Now, is this a delicacy in those parts, or does it speak to other issues such as hunger that may have resulted in these young children eating this carcass?
So I think that both factors can be accounted for. There are certain places that eat things that generally people don't eat. But then considering where the outbreak is located, most people are saying that it's a very poor state, and it could also be as a result of hunger and inadequacy of food. And so that could be the reason for which they are eating the bats.
So let's talk about the challenges that health officials are facing in responding to this outbreak, particularly because this area, as you say, is remote.
Yes. So there'll be challenges, of course. If we can draw some lessons from COVID, we know that initially there's a lot of misinformation and then there's a lot of fear and panic. So that's the first challenge everybody needs to deal with. Now, everybody's looking up to the officials. What are you doing? What is happening? And then the officials come out and say, we're not really sure what it is. We're trying to see if it is this or that. There are reports saying that it's from the bats. There are reports saying that it's from a poisoned water source. So it's just the general fear and panic. Now, how would they even take the information you bring to them? Because you're not even sure yourself. People are not patient to wait for investigations. What has been done is that it's similar to certain diseases because of the presentation. Investigations have been done for Ebola and Marburg. They've come out negative. So that has allayed some fears. But then it's coming from water sources in a very deprived place. What are the government officials doing? Health workers and health officials are only limited in what they can do when there are issues of social determinants of health affecting the outcome of health and then its impact as well. So are government officials, or is the government involved in how to deal with this disease? Now, what information do you even have to buttress except the fact that people are falling sick and people are dying? So the challenges are a lot. But a lot has to do with which information are you giving out, especially when you're not sure. How are we taking the information, especially when you're not sure? So I think that this is the major challenge that people are facing.
Now, the one word you don't want to hear is illness. And it's aggravated when you hear mystery illness, because it almost suggests that people don't know what is happening. So let's talk about the WHO and other global agencies. At what point do they come into trying to deal with this situation?
So they mostly come in as soon as a strange illness is reported. So first, it'll have to come from the surveillance of the country. So then when the country reports there's a strange disease, that people dying, and the case fatality ratio in this case is quite high, because we've had over 50 people dying with almost 500 people infected. So we're looking at about 12%, and that's very high. So that's a public health concern. And so WHO, all the public health organizations would need to come in, especially when the case fatality ratio is high. Because we've learned a lot from COVID. It could just start from a small town. The next thing we know, the whole world is infected. And so they come in immediately. They hear that there's something that is killing somebody in 48 hours. It shouldn't happen. What is happening? Is this as a result of the disease? Is it the weak healthcare system? Is it the poverty in the area? So all of these things have to come in play. The tests have been done to show that they are negative for Ebola and Marburg, as I mentioned. But then WHO will also come again to come and do their own surveillance and then come and do further tests to be sure that our suspicions are not what it is. I think that even there'll be a bit more relief if we find out that the disease is something we know. Then there's an idea of how to manage it and how to contain it. But then if everything you're testing for is coming out negative, then it raises more concerns, not just with the people, but then with the health officials and then the organizations as well.